Welcome, everyone, to the Weekend Warrior Show. I'm your host, Curt Sandoval, with Dr. Klapper. You're the doctor. I don't play one on TV. How was your week?
Very good. I know a lot about the hip, and you know a lot about the hop.
That's what makes good chemistry, right? Hey, there's so many injuries in the NFL, the NBA, Major League Baseball starting the playoffs. But one of the things I just really want to reiterate to our audience, this is a Weekend Warrior Show. It's not a pro sports show. It's for you, the weekend warrior, the man or the woman who is out there playing golf, picking up groceries, doing what they need to do, but understanding the body a little bit. That's what I want to convey. From your standpoint, what I love, Dr. Klapper, is you're an artist. You paint a picture. So if you can, as we go into today's tapings, what do you like to convey to the weekend warrior?
That God made us all the same, that it is a warrior we're talking about, and I don't mean the Golden State Warriors, but the professional athlete who it's my privilege to get to take care of when they hurt themselves as well. But trust me, their anatomy, their shoulder, their knee, their ankle is no different than yours. And you may think they're getting specialized treatments and what. No, the anatomy is the same. And that goes for the fact that whether you come from China and I don't speak the language, or South America, it's just delightful to be able to see the anatomy underneath that skin, whatever color it is. The inside is exactly the same.
Oh, that's awesome. That's awesome. Well, I know a lot of people out in the world play this crazy thing called fantasy football, and the Chargers' Austin Ekeler, fantasy owners are dying on the vine here. I say that jokingly, but Austin just is such a dynamic player. A young man who has overachieved in life and really shows you what the mental aspect can do as well as the body. But he has this thing called a high ankle sprain. And in my life of covering, especially the NBA, there's a lot of ankle sprains all the time. I don't understand what a high ankle sprain is and compared to just an ankle sprain. How would you describe it?
So we all know what it's like to roll our ankle, and I have some anatomy to show you. Just simply rolling your ankle, there are three, like your three fingers, ligaments that shoot down from the fibula, the name of this bone, to your foot. One in front, one down the center, and one out to the back. And a simple low ankle sprain is rotating in severely, and you bust this ligament. It will go on to heal. The swelling will go away. The pain will go away. But the key is, we need to get you into a brace, boom, so that it heals at the correct length. You don't want it to heal slightly longer because then you end up with chronic ankle problems like Steph Curry or Cam Newton, who needed later surgery to tighten it up.
Wow.
Well, the other interesting thing about a low ankle sprain is living in this ligament is a burglar alarm sensor. Eli, we have to get a burglar alarm sensor.
Eli's our producer who just pulls all the great graphics.
Because if you're at home and a burglar's lifting up the window to break into your house, the sensor gets tripped and the alarm goes off. Well, it's hidden inside this ligament, which is a structural piece of canvas, if you will, giving your joint stability, is an electronic device. And I mean literally, like the battery and the wires of the sensor to your brain. We have a fancy name for it. It's called the Golgi tendon. And the technology is called neuromuscular or proprioception. So when you rotate your ankle and you're getting close to tearing it, the burglar alarm sensor goes off to your brain, and immediately the muscles and tendons on the little toe side of your ankle, the peroneal tendons, without you thinking about it, it's a reflex, involuntary, they fire to swing your foot back into position.
Wow.
So a simple ankle sprain ain't so simple.
So I'm going to interrupt you for a second, and this was not part of our discussion, but this is what we call, live TV, even though it's not live. All right, we're taping here at College of the Canyons. In Santa Clarita. I used to live across the street, and I kid you not, back in PK, pre-kids, 20 years ago, I'm running sprints on the track here. And on this track, there's a metal railing that is no longer there, just to make it an official track. I'm running full speed, and I hit that metal railing at full speed. Okay, so it goes this way.
Yes.
And I now, 20 years later, I have chronic left ankle issues. And is that because it healed long?
Because it used to be this long, and it healed this long. So there's extra slop or play in your ankle.
That is fascinating.
Which leads to, just like the alignments off in your car, leads to early wear of the tire. You will get arthritis in your ankle because of it.
Man, that is amazing. So if you're a weekend warrior, and I'm sure someone is watching that's had an ankle that they twisted years ago and it's not right, okay, so that's me.
Right.
Is it a simple ice it more? Do I go see someone to...
You need to go see someone to see what the level of damage is of the cartilage in the joint.
Okay.
Is it worth just realigning the tires, or do you need new tires? We don't have a pill or a shot that grows hair back on top of my head, and we don't have one to grow the cartilage back.
We've got something in common then.
Exactly right. But this is why it's imperative that a simple common ankle sprain, you need to be put right away in a brace to get it to heal the right length, because that also gets that sensor, that burglar alarm sensor, back to working properly. Because if a player goes back quicker, yeah, they may feel less pain. Yeah, but if it's not 100%, the sensor is still out. So when they run and hit uneven turf or tackled and they roll in, they don't have the feedback to the brain to fight. They're going to do a bigger injury down the line.
Oh, that's fascinating.
So that's a low ankle sprain.
Now back to Austin Ekeler, a great running back for the Chargers. He has a high ankle sprain.
Right.
What's the difference?
Big difference. And let's do a Klapper vision.
Okay.
So, Eli, let's have... This is our beloved Hawaii. You can see one of the islands.
That is beloved. That's Maui, right?
Right.
Or so it seems.
And look at what the ancient Polynesian discovered. They're not using Daniel Boone's canoe that you would take on a lake or a lazy river,
right,
which has no waves.
Right.
You can really move quite well with a regular canoe, which is where these people are sitting.
Absolutely.
But when you are in the Pacific Ocean trying to go between islands and wind and the waves come, good luck with just a simple canoe. You're going to tip over.
Tip over, right. Big
So
wave.
what did they come up with? An outrigger.
Stabilizing it.
And notice how there's a front and a back perpendicular to the long axis of the canoe. These structures here are critical to bond the outrigger, the little tiny canoe, to the big canoe. Well, if you now look at our model, I'll have you hold it, Kurt, the tibia, which is the big bone, is where the people are sitting.
This.
Right. The little bone called the fibula is the outrigger.
So it'd almost be
Correct.
just a mimic.
Exactly right. And you see these perpendicular structures that connect the outrigger to the main canoe to give it stability. Well, we have a canvas-like material called the syndesmosis that bonds these two bones together. And we need two bones for all kinds of reasons, but mostly let's just take away from today stability. So when you plant your foot, Austin Ekeler, and you want to cut and be able to accelerate, you need those two separate bones to behave as one, essentially. You need the canoe and the outrigger to behave as one when the big wave comes. But if you rip or break the bond between those two, you now have two separate bones, and your ankle now is unstable and it hurts.
So that's amazing. First of all, that's amazing, because the first thing that I think of is what you said right off the top. No matter what color of the skin, no matter what nationality, God made us just similar. Just
Cooper Kupp and Puka Nakua are the exact same anatomy to Steven Weinberg, who's watching this podcast.
That's right. That's right. So if Austin Ekeler twisted his ankle, he did something to the point that the little canoe braces, these things ripped right here.
And we can grade them. Tua Tagovailoa did this at Alabama and separated completely.
Wow.
He needed to have them
surgically repaired.
So same thing, I believe, for Rob Gronkowski. These high ankle sprains were traditionally season ending, not career, but season ending. You're out.
Which was Cooper Kupp last year, right at the end of last year.
So
and he
we're
had
now
this...
able to use a new device, which we can get into on another podcast of how to treat these if you do need surgery, because Austin Ekeler, thankfully, does not need it. It just needs to heal.
So one of the things is he's here. As we tape this, we just finished the 4th week of the NFL. He injured it week 1. He's been out 3 weeks. If you were his doctor, do you suspect that knowing that they have one more game then a bye week, would you err on the side of caution? If he's ready to go, would you say, nah, let's wait 2 weeks, it'll be even stronger, or does it matter?
It matters. And I think if you do have that bye week really looming out there for you, this is an easy one for me, particularly since they just won their last game. It's
Right.
an easy one for me to get him right, because you put that player at risk for overcompensation with other body parts that could be injured.
So it's interesting you say that, because as we tape this, Saquon Barkley, I thought it was a low ankle sprain, but now they're saying it might be a high ankle sprain. If it's the low, and I'm hearing you right, and this is just fascinating. This is just fascinating.
I'm glad you're my greatest audience, Kurt said. This is why we're doing the podcast.
This part is this part. I can see it so well.
Yes.
You know, it's a fabulous Klapper vision.
Thank you.
But if we're talking about Saquon Barkley, how do we know if it's this, which I did, versus tearing something? How do you know that difference?
So there's a very elegant test called a squeeze test. We literally can feel your ankle and squeeze these two bones together. If I squeeze a normal syndesmosis, where this junction, this bond is intact, it's healed, you can squeeze, you can be a running back and get hit by a 300-pound tackle. It doesn't hurt.
No problem.
If there's any kind, you can't see swelling per se, but you can, your body has these beautiful nerve endings, and if it ain't right, that's what pain is. I love pain, because just shooting it up to numb it up is not in the best interest of a player with this kind of injury, because you need that feedback to know that you're not injuring it more.
So do you sense by everything that it's taking Saquon longer that that's a high ankle sprain?
Yes.
Okay.
Yes.
That's great.
Not only sense, but I think I've even seen him in a locker room being interviewed to say that.
So he's in the same bucket as Austin Ekeler. The longer you can take to let it heal, as long as it's not like a Cooper Kupp where you need surgery, the better. Is that accurate?
Well, Cooper Kupp didn't have surgery. He doesn't need surgery, but this needs time. Both of them, it looks like, have a high ankle sprain of a variety that does not need to be operated on to put the bones back together again.
That's fascinating. All right, this is the Weekend Warrior Show. I'm Curt Sandoval with Dr. Klapper. When we come back, we're going to talk about Derek Carr's shoulder, because I learned something fascinating before this, and it'll blow you away about what your shoulder really can't do. That's coming up next. Hi, everyone. Welcome to another edition of the Weekend Warrior Show. I'm your host, Curt Sandoval, with the doctor, Dr. Robert Klapper. How are you today?
I'm great, Kurt. Great to be here with you.
Okay, you know, you love sports. One of the things about Dr. Klapper, he is a medical genius, and yes, you are. Yes, you
I
are.
have to adjust my headset now. Thank you.
Compared to us. But he has this unbelievable ability to paint a picture of what the body can do and what it should do. And I love what you said in our last taping, that the average person, the weekend warrior out there, if you're watching out there, you are exactly the same as, pick your favorite athlete.
Yes.
Your body is really the same.
Totally the same. And, you know, this comes from not from what I read in a book, although you need to read the book, but over 16,000 surgeries,
Wow.
35 years being an orthopedic surgeon, to take a history, to physically examine someone. This hurts, this doesn't hurt, to see atrophy, the neurologic exam, then to have an MRI or a CAT scan or an X-ray. But then to be able to take a scalpel and go in and see it over 16,000 times, it really, to me, is the most beautiful architecture, the most beautiful sculpture, art that you can ever create.
That's that sets me up for one of my favorite quotes in life. is don't let school get in the way of your education, right?
Exactly.
You've been educated by doing this. Well, one of the things we're talking about, if one of the biggest sports franchises that hasn't had a ton of success in the last couple of decades, but used to be, just the sports franchise is the Raiders. And the Raiders are just followed everywhere. Well, a former Raider quarterback is now in New Orleans, and Derek Carr played up at Bakersfield, played at Fresno State, and he hurt his shoulder. When I say he hurt his shoulder, that's a sportscaster's guy. From a Cedars-Sinai orthopedic surgeon, what is going on with his shoulder?
So I would love to take advantage of you being the weekend warrior in the room.
Okay.
And so for those folks watching us, and if you have a partner, put your hand on the shoulder blade of your partner, and now take their hand and their arm and bring it from the side of their body, 0 degrees, to 90 degrees. And what you'll appreciate is your hand is on their shoulder blade. It did not move. But to go from 90 to 180 over your head, to throw a football, to catch a football,
To grab the rebound.
to whatever you need
Raise
to
your
do
hand and clap.
overhead, you would feel that from 90 to 180, the entire shoulder blade rotates on the rib cage. Why is that?
You just stole my words. I was about to say why.
Because the ball and socket joint, the glenohumeral joint, glenoid is the name for socket, humerus is the bone. It's not very funny, but the humerus and the glenoid is designed, and here's the acromion bone on top, to go from straight down, touching
0
your
degrees.
pocket, to 90. Because the greater tuberosity, this bump hits literally like a doorstop. So you only can go with this ball and socket joint 0 to 90. Well, then how the hell do you get your arm above your head?
Yeah, hold on. You said that to me earlier. It can only go 0 to 90. It can only go to here.
Correct. And so I'd love to do a Klapper vision with you.
Okay.
Where something else we commonly know also can go only from 0 to 90, which is a camera mounted on a tripod, those 3 little legs.
Wow. Well, ask and you shall receive.
Great.
In a shocking development, look what I found.
Correct.
Okay.
So this camera, and you can show this, Curt, has a limitation. The camera itself will hit the leg.
Right.
The camera itself going the other way will hit the leg. It cannot go 180 degrees. So if you're trying to track a baseball player, for example, hitting a line drive, you don't really need to move this camera much as it's on the tripod.
Right.
But what if Shohei Ohtani decides to hit one of those 450-foot home runs that arc their way out of the stadium?
Right.
Your camera could only go back so far.
To there.
The only way you're able, with a tripod, obviously you can do it with a camera. They do it all the time with a TV camera. But I'm
Right.
talking about a camera that's mounted on a tripod. The only way you could do it is if you take the legs themselves and now move the camera, which can only go 0 to 90, to get 90 to 180. Exactly right.
Like that.
Well, now let's look at our shoulders again. You've got a beautiful leg of the tripod, and I would say to you, your collarbone is one leg of the tripod. The spine of the scapula is another leg of the tripod, mounting the camera, your ball and socket joint, away from your rib cage. These legs, your clavicle here and the spinous scapula, are critical in allowing the movement to get your arm from 90 to 180 over your head. So when you have kapow, an injury where the clavicle, remember this bone is called the acromion, this is the clavicle, that's why it's called the AC joint, acromial clavicular joint. If this is disrupted, then it's as though, the Klapper vision, you've damaged, loosened, ripped the bolt off of one of the legs of the tripod to the camera, you're not tilting back so easily.
Yeah,
You'll have
it's disrupted.
difficulty with overhead use.
Okay, so which brings me to, let's go back to Derek Carr for a second. You can see the pain on his face there, which speaks volumes. When that thing is disrupted, the clavicle, which is the AI, explain that again, because I'm a little slow learner here.
So when you disrupt the leg, one of the legs of the tripod, remember, this is the camera mounted, and so you can now move in all different directions. But I'm saying if you loosen this, the ability for it to work as a unit to go up is now disrupted.
So how do we know if I'm a weekend warrior and I've had that injury before?
It's looking like every single one of these injuries you've had.
I play hard,
which I love.
So if is that simple rest? What gets that thing back, that tripod back together?
So we love to grade the severity. I see patients, hockey players, for example, crashing into the boards.
Yeah.
Very common to have grade 3, which is a complete disruption. The bones no longer are kissing. And you can imagine a grade 1 or a grade 2, it's not separated. So when it's a grade 1 or grade 2, very rich in nerve endings at the junction between the clavicle and the acromion, you can see his face, how painful it is. But those will go on to heal. Even the separated ones, if you're a weekend warrior and you're sitting at a desk all day long, there are a lot of ones I've left alone and you have a bump.
Yeah.
And it makes for a nice conversation at a cocktail party. But it is, if it's tenting the skin, there are reasons that we have to do surgery. But I will tell you, in football, a grade 1 or grade 2 AC separation, exquisitely tender. I can't speak for what was done to Derek Carr, but because it's not really the ball and socket joint where we would worry about injecting material into the joint, this is something you can make pain-free with an injection and get back onto the field before it's fully healed.
So one of the things I hear as a weekend warrior, and it goes back to Tim Lincecum when he was pitching for the Giants, his dad said, the only thing that should have ice is my drink. And I was like, don't know if I subscribe to that. Cryotherapy is a big thing. Ice baths are now a big thing. Is that something where ice helps the inflammation? When do you know to ice? I hear this all the time, Dr. Klapper. When do you know to ice? When do you know to heat?
So here's the best answer for it. It's always about the anatomy. And here the anatomy is when things are ripped or torn, you're also tearing blood vessels, microscopic, but you're tearing them. And blood vessels will pour blood into an injury, into a muscle, into a disrupted AC joint, whatever it is. The muscle and those pipes that feed the muscle, those arteries are different from a vein because the artery actually has muscle in the pipe, which can make the pipe go from being super wide to go into spasm. If you can, with ice, you know what it's like when people get frostbite or when your fingers get numb because it's so cold, the spasm, the shrinking of the lumen of the size of the pipe is because the smooth muscle contracts. Well, if you have an acute injury and I can get the pipe to shrink in size, you'll have less spasm, less bleeding, less pain. So an acute injury, get ice on it because that can allow your vessels to go into spasm. A chronic injury, like your ankle, like you've told us, would enjoy more healing blood supply. So in that case, you, with the muscles that line the pipe, you would want to open up the pipe, which it can do as well. That's dilation, vasodilation. How do you do that? Heat. So generally, I tell patients, it feels so good to make it warm. But if it's an arthritic condition, you're going to get a more swollen ankle or swollen knee if you just do heat. But it feels so good, Dr. Klapper. Good, you can do it, but you should always follow it up with ice.
Gotcha.
Ice is your friend, especially in an acute injury.
So perfect that you said acute injury, because this is why I said at the top of our broadcast, you're a genius and I'm not. Acute, define for our weekend warrior when you say acute. That's common vocabulary for you.
Usually it's the first 6 weeks.
Okay.
That's generally. You start getting 2-3 months, it becomes more of a different mechanism that the body mounts to heal. And obviously that's different than 2 years, 20 years. These are other things that are in the word chronic, but obviously it's a different kind of chronic. And the way our bodies heal is fascinating. And I would just take you to a Klapper vision. If you cut your finger, it bleeds. It's liquid, that blood. Leave it alone for a little while, it will become like chocolate pudding as it coagulates, the platelets and the cascade of making a clot. That chocolate pudding is seen by cells in your arteries called fibroblasts that look for chocolate pudding, that look for clot. They jump on the chocolate pudding, and these cells secrete pasta, spaghetti strands of collagen. It's almost like they're throwing a fishing net on top of the mound of chocolate pudding. That's the early scar that takes place. And then there are other cells in our body that look for fishing nets. Though in the case of a fracture, those are osteoblasts. They go fishing nets, they jump on the fishing nets, and they secrete calcium and mineral and make early callus. And then we have other cells that come later that, like a sculptor, fine-tune it. Those are called osteoclasts. So at the end of a year, what looked like a stack of fishing nets in complete disarray looks like a beautiful Navajo rug.
You're amazing. I'm just trying to get a couple minutes of sports on the air. You're I can't even say it. Yeah, that's amazing. In summary, I want to finish with Derek Carr.
Yes.
You talked about how, at what degree. That, if I'm hearing you right, that's really the issue, is what degree did he hurt this? If he plays the next week, does that tell me it's a first degree?
It doesn't. It doesn't, because we don't know if we had changed the natural course by giving him medication, giving him a shot, so he can still play pain-free. And it really should not interrupt his it's the pain that really stops you. Unless it's completely dissociated, it's so painful that he wouldn't be back. So I didn't see him, but I sincerely doubt it's a grade 3 separation.
So for the weekend warrior out there, you mentioned hockey. I have so many friends, the old cliche when you grow up playing hockey, all roads lead to the beer league. And there's a lot of great beer league hockey players out there who are still getting checked in the boards. There's people still pitching that, or throwing to their kids. You touched upon this, and I think this is important for anyone with a shoulder issue, is if it's in the first 6 weeks, it's ice.
Yes.
And B, it's the pain level.
Correct.
It's really not the potentially the injury. Am I hearing you right?
You are. Make the good scar tissue. A lot of vitamin C in your diet that glues the collagen fibers together. The vitamin C is the marinara sauce. The strands of spaghetti is the collagen.
Wait, I've just got to ask you. This is our second taping, and we're going hard to the rack on spaghetti. Do you have a favorite place? We live in the greater Los Angeles area. Where do you go for your spaghetti?
La Scala in Beverly Hills or Dan Tana's, they're the best. My mouth is watering giving you that answer. How about you?
Where did you and I went to lunch the other day, and I'm drawing a blank. There's a place here in Santa Clarita that I took you to, and I'm just blanking on the name of it. But I will tell you, Grandma was Italian, and Grandma's from Italy. So.
That means when you eat it, it doesn't go in your stomach. And I'm a doctor saying this. It goes from your mouth to your brain. It goes directly to the source.
Into your heart.
And into your heart.
Yeah. Who doesn't, I don't care how old you are, who doesn't love a good batch of spaghetti?
That your grandmother made.
That Grandma made from Sicily, no less. All right, that's our show for this week. Again, plenty more to help you out. Next week, hey, if you got questions, don't forget to hit us up on our Facebook account, our YouTube, wherever you're watching this. Drop a question about your injury or any other injury, and next week we're going to start answering questions wherever you're watching this on your podcast. For Dr. Klapper, I'm Curt Sandoval. You have a great week, buddy.
You too, Curt.